must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
So really, we just want to assure all Kenyans that we are working very hard as a ministry, as a government, as a health sector, as a country, a whole government approach to addressing the challenge that is currently facing us of coronavirus. And the team that we have been meeting with this evening has been a team of experts, some health workers, experts in communication, experts in social media, all looking at how we work together to make sure that, number one, Kenyans are aware, they are well sensitized about what we are dealing with, that we all also learn what precautionary measures we need to take to ensure that we can prevent ourselves from getting coronavirus, and also to ensure that we protect our families. The team of experts here has been doing a lot of work in terms of their own practice, the clinical practice, the protocols around coronavirus. This is a new virus that the medics have never dealt with, that the entire health workers have not dealt with. Feel that you're very ill, to go into a matatu, to go to hospital, we really recommend that you call the 719 line and get us to come and pick you through an ambulance which has got specialized facilities and with health workers to take you to an isolation facility where you can be tested. So basically, we are just aligning our coordination and making sure that we have a seamless operation even as we deal with coronavirus. And I just want to thank the entire team, the entire fraternity in communication world, social media world, our experts in health, for their really for their commitment and self-sacrifice. We've been sitting here up to very late hours in the night, days on end, and people are here really just volunteering themselves to serve this nation. So my deep appreciation, and to all of us, please keep us hooked up for our conversations, be kept in the loop through hashtag Komesha Corona. Thank you very much.
I'm joining the World Health Organization's Safe Hands Challenge. Hand washing is one of the most effective ways of preventing the spread of coronavirus. Wash your hands with soap and water for at least 40 to 60 seconds.
President Uhuru Kenyatta outlined a raft of new measures to contain the spread of coronavirus in the country. Such measures, among others, include the restriction of movement into and out of designated counties of Nairobi, Mombasa, Kwale, and Kilifi. It is important that we all, as Kenyans, adhere to these measures if we are to score significant gains against this monster and keep our country safe. Each and every one of us, and collectively as a country, we are now called to observe and watch over these measures. Let us not shy away to point out those in our midst who are not observing the measure and thereby putting the nation at risk. In line with the pronouncement by the President of the importance of wearing face masks, let me reiterate that it is critically necessary that every Kenyan wears a face mask whilst in public spaces. Everyone must make the effort to get a mask to protect themselves and others, as we endeavor to provide them some where we can, free of charge, through our county governments and other partners. The measures announced so far call for
Good morning, viewers. Welcome to Punchline Africa Television, broadcasting from the Republic of Kenya in Nairobi. Viewers, thank you very much for this morning daytime express show, which was supposed to start at exactly 9 o'clock in the morning. But you have heard from the Minister of Health of Kenya, the Cabinet Secretary for Health of Kenya, Mr. Mutahi Kagwe. A painful decision, a painful period coming ahead of us. Therefore, wherever we are as journalists, let's educate the people on pros and the cons. Partial lockdown is very important. We shall look at it in the main broadcast that starts at Good Morning Africa at 11. Miriam and I will peruse through inch by inch, soil by soil, to bring the facts and the weaknesses. But so far, the facts outweigh the weaknesses. Partial lockdown solves the problem when you add discipline. If we are disciplined, we shall find exactly who is who, where, and how. Discipline is very important. That's why every government in Africa is emphasizing discipline. This morning, I woke up a very happy man at 4 a.m., very relaxed. With me in the headquarters of Punchline Africa Television is none other than Miriam Ogutu. I'm talking while standing, Miriam, and now I'm doing exercise. Instead of sitting like you, I am standing, and I'm talking while standing. I will sit later on when I want to take any questions. But I want to do an exercise by standing up, by relaxing my legs. While I read, I bring the news to the world. Donald Trump comes up to say exactly what I've been saying here. That's what I wanted to say, Miriam. I woke up very happy man at 4 a.m. I read my Bible. The famous verses, you know them, 2 St. Luke and Jeremiah 32. I was very impressed when Trump came to the same conclusion that I came to in November in 2019. I told you that the World Health Organization was misleading us, and the people could not believe me. Some people thought I was a lunatic. But I'm not near Prophet Elijah and the Jewish prophets that lived in those days of King Solomon and King David. But I'm just David from that great country of the Pearl of Africa, a global citizen, preaching the truth, nothing but the truth. Discipline, partial lockdown with discipline will bring results. Don't disagree with the president. It is wrong, immorally wrong, for you to disagree. Let's put there the numbers. Let's put the numbers where people who are in need can call. We can help. But partially, let's lock ourselves down. This disease is carried, moved by us individuals, by cars, by objects. Partial lockdown while isolating the enemy the enemy's COVID-19, any military science, any military scientist who has read the military science and the military intelligence will tell you that for you to win a war, you must know the weaknesses of your enemy. One of the strengths of our enemy is it moves along with us. The worst strength of it is invisible. So if you wait for it and move it from Kampala up to Mbale or from Nairobi up to Mombasa, you are now the one who is causing the movement. Thank you, Miriam. Test the microphones. You can see I'm relaxed. Yes.
A very good morning to you. Just continue. I'll get back to you in a short bit. I need to fix something here.
I can even hear you, that even if with or without the microphone, I can hear you, because I was going to tell you that you had forgotten the microphone. But thank you very much for me on this other side. I want to thank you all. I want to thank you, all of you who have listened to me, who have listened to my appeal, who have read my documents, who have read my books, the documents, the journals, the articles, the posts that I have put forward. I will not give up. I will always hammer the same point. The legacy trend does not sleep. We tell you as it is. If you don't carry that message, go to our website. It is shining there. The 80 million people who are reading all coming to 9 million so far now to 10. Thank you very much. Take in some information from us. We do thorough research, comparative writing, comparisons with areas. We bring in the most important key elements of supporting President Uhuru Muigai Kenyatta and his policies. Let me come to first the head. We come to the reading that is becoming a ritual in Africa, which we have to do. I read the first 10, you catch the first, second 10. As of this morning, Kenya had confirmed cases, 172, 6 people dead, 7 recovered. Sao Tome and Principe, 4 cases, no death, no recovery. South Sudan, the cases seem to have increased to 2, no death, no recovery. If you look at, I hope I'm being captured properly. If you look at the situation, is it okay, Miriam? Am I still covered properly? Yes. Yes. Let me come on the level with you. The sea, I have come to sea level. Sudan, South Sudan, 2 cases, no recovery, no death. Uganda, 52 cases, no recovery, no death. Confirmed cases in Tanzania, 24, 1 dead, recovered 5. Central African Republic, 8, 0, no recovery, no death. South Africa, 1,749, oh my God, dead 13, recovered 95. Miriam, it looks the cases of South Africa increasing at a very alarming rate because they didn't have partial lockdown. They allowed the people to move from Cape Town to Durban, Durban to Pretoria, Johannesburg. That has caused what we see in South Africa. 749 cases, 13 dead, 95 recovered. Algeria, 1,468, 193 cases, recovered 113, Miriam.
And in Burundi, the cases there that have been confirmed so far is 3. Zimbabwe has 11 confirmed cases and 2 people have died. And in Sudan, confirmed cases is at 14. 2 people have died and 2 have recovered. And in Egypt, confirmed cases is at 1,450. 94 people have died and 276 people have recovered. And we see in Morocco, confirmed cases is at 1,184. 90 people have died and 93 have recovered. Liberia, confirmed cases is at 14, with 3 people dying and 3 people recovering. And in Chad, confirmed cases is at 10 and 2 people have recovered. Burkina Faso, confirmed cases is at 384. 19 people have died and 127 have recovered.
Thank you very much, Miriam. You were on
Burkina Faso. You can pick on Somalia.
Burkina Faso. Somalia, 80 cases. Or Burkina Faso. Should I read Burkina Faso?
Somalia.
Burkina Faso, 384, dead 19, recovered 127. Somalia, confirmed cases 8, recovered 1, no dead. Gambia, 4 cases, dead 1, recovered 2. Cameroon, 685, now dead are 9, recovered are 60. Senegal, 237, 2 people are dead, 105 recovered. Ivory Coast, 323, dead people 3, and 41 have recovered. Ghana, 287, 5 dead, recovered 13. Mauritius, 268, dead 7, recovered 8. Nigeria, 254, dead 6, recovered 44. Democratic Republic of Congo, 180. The cases have gone up now in DRC. 18 are dead, recovered 9. Congo Brazzaville, 45, 5 dead, 2 recovered. Rwanda, 105, 7 have recovered, no death reported so far. Madagascar, 88 cases, recovered 7, no dead. Zambia, 39 cases, 1 dead, recovered 7. Togo, confirmed cases, 65, 3 recovered, 3 dead, recovered 23. Mali, 56 cases, 5 dead, recovered 12. Niger, 278, 11 dead, 26 recovered. Ethiopia, 52 cases confirmed, 2 dead, 4 recovered. Tunisia, 623 cases, 23 dead, recovered 25. Djibouti, 90 cases, recovered 9, no deaths. Guinea Conakry, 144, 5 recovered, no dead. Equatorial Guinea, 16, recovered 3, and dead 0. Gabon, 30 cases confirmed, 1 person dead, recovered 1. Libya, 10, no death, no recovery. Mozambique, 10, recovered 1, no death. Seychelles, 11, no death, no recovery. Sierra Leone, 6, no death, no recovery. Benin, 26, dead 1, recovered 5. Miriam, Eritrea, confirmed cases 31. Angola, confirmed cases 17. Dead 2.
All right.
Recovered.
Yes.
Thank you. Take over from there.
And we look at the Africa statistics as they stand right now, and confirmed cases in the continent right now is at 10,252 cases. The death toll there is at 492. Although on the coronavirus tracker, I think the latest one that I've seen from production there, Africa death cases seems to have gone up, and they've hit the 500 mark, and they surpassed that, and the recoveries in the continent is at 993. Infected countries right now is at 52, and the only virus-free countries are still is Comoros and Lesotho. And the global statistics, the total confirmed cases still now across the globe stands at 1,431,944. Confirmed cases today only is at 998. Death till now stands at 82,085, representing a 5.73% of the total number of confirmed cases across the globe. And the death the new deaths today that have been recorded is 49. Critical cases globally is at 47,894, representing a 5% of the total confirmed cases. And also recovered, or the people who are also been discharged, is at 302,209, representing 21.11%. And we have countries that have been affected worldwide right now stand at 209 countries.
Thank you very much, Miriam, for that breakdown across the globe. India, 5,356. Dead, 160. Recovered 468. Dead today 5. It's because of partial lockdown, and that is why India, with a population of 2 billion, has got only 160 dead people. Go ahead, Miriam.
Indeed, in the United Kingdom, right now, confirmed cases is at 55,242. 6,159 people have died, and the people who have recovered is still at 135. And in South Korea, confirmed cases there is at 10,384. 200 people have died. 6,776 have recovered, and confirmed cases in South Korea today only is at 53, and 8 people have died today.
China, the epicenter, 81,802 people confirmed. Dead, 3,333. Recovered, 77,279. Confirmed cases today in China, 62. Dead people today in China, only 2. Mr. Chinese, you bring the medicine, because you seem to have the medicine. Show us how you also cured these people. Otherwise, haki ya Mungu pesa huwezi kupata. Africans are very stubborn, and that's why they fought colonialism. And for you not to tell us where the medicine is, while we are going to die and the thing started from you there, you are doing us an injustice. We shall revolt. We shall fight you up to the end. Yes, if you don't, payments will not come. I'm telling you. You know, Miriam, it is not a joking matter anymore, my dear sister. Which African country is going to pay this money? China better tell us quickly so that our people start using the railway. 2 people only in a population of 1.2 billion. Can you imagine? Can you imagine? There must be something they are doing. But China is a military state. When they say go inside, you don't go, they give you a bullet. You have seen the corruption. There are so many people who would have mourned if we were in China, in Kenya, If Kenya was in China, I think there would be more orphans on corruption charges. Miriam, what do you think?
Mm-hmm. It's very
yes.
true. Yes.
What do you think?
There will be a lot of orphans when it comes to corruption. Yes. And that is how China has dealt with corruption very decisively, and that's why today it's able to lend to the whole world.
People are disciplined. President Uhuru Kenyatta puts on a partial lockdown of Nairobi. People are all over the whole place making noise, belittling him. Someone even using a telephone to take a picture that is using a panya road to go home. Wewe enda nyumbani lakini uweze kurudi, maybe utarudi kwa 6 feet down, because this thing is real. Stay where you are. If you are medically ill, you can access that type. Stay where you are. Some of us looked at traveling by plane, not because we did not have tickets to travel home, but you weigh the conditions. Maybe where you are living, you are going to end there, and this thing is everywhere on the plane. You know, the plane people who wash also are also part of the problem. Those who clean the planes, they touch and leave it on the surface, and you get it. So the basic thing, some of us made a decision to stick, and God will save us from where we are. Miriam, next.
We go to Spain, where confirmed cases in the country right now stands at 141,942. The people that have died in Spain is at 14,045. 43,208 have recovered. And in the United States, confirmed cases is at 400,540, and the death toll right now stands at 12,857. Recovered cases is at 21,711, and confirmed cases today only is at 205. The death toll today is at 16.
Go ahead.
And in Italy, confirmed cases is at 135,586. The death toll there, Italy still leads at 17,127. And recovered persons there is at 24,392. And we finish with Germany, where confirmed cases is at 107,663. The death toll in Germany is at 2,016. And recovered cases is at 36,081. So that is the latest statistics, and we've looked at Africa and also some of the key countries across the globe, and we see the death toll there has really risen. And even in Africa, I'm now beginning to get worried for a country like Algeria, which is the one that is leading in terms of the death toll, but South Africa is leading in terms of the number of confirmed infections.
Okay, thank you very much, Miriam. Then we come to the news across Africa. Today, let's begin by telling the people what type of news we have across Africa. Because we have very interesting news coming in from different countries. The Daily Nation of Kenya, which you can lead me now, because yes. I'm incapacitated on the angle of Daily News. I don't know whether you have.
Yes, I do have the Daily Nation with me here, and a Nation Media Group public health campaign. That is what they're saying there. They're saying stay safe, hashtag wear a mask together, cover your face when you leave your house to protect yourself and those around you. In face of spiking cases of coronavirus, the World Health Organization yesterday revised its guidelines and advised everyone to wear masks, in addition to other measures like washing hands and observing social distancing. That is the front pages of one of the leading newspapers in Kenya, the Daily Nation, and it's very important. They're having their own public health campaign, and now World Health Organization just comes up yesterday and is telling the world now it is time to wear the mask. I think this is an advice, or this is a that should have been given, a directive that should have been given so long ago. Why? Because I was watching another interview with the doctor from China who was saying the reason why China has been able to keep the numbers low is because everybody was required to wear a mask. So that really has saved and has really saved and helped in terms of curtailing the spread of the virus. So why is it that right now, when the death toll is high and the numbers are high, is when the World Health Organization is coming out and now saying it is very necessary for anybody across the globe when you're going out to wear a mask? Why has it taken it so long to give such a directive? That is, I think, the big question here.
Miriam, this is a question I told you. I have been investigating the World Health Organization since November. There is no single statement that they made which came true. They retracted it, or told us a lie, or did not tell us, or hid the information all together. This was the first call when this guy made President Xi of China. They should have sat down. They sat down in China, in the Red Square, where the headquarters of the Chinese Communist Party and the headquarters of China ruling party is, and the chairman of China sits there. They had very good lunch, very good noodles, very good Chinese crispy duck. And this Ethiopian guy was, if you look at his face when he was meeting the president of China, I don't know what he carried from China. He must have carried dollars and forgot the rest of us. He left China when they wear masks. He left China when they wear masks. People were wearing masks. He did not come back to Geneva to tell us to start wearing masks or to wash our hands. Africa has just picked up its cases. Yesterday, President Faramijo I was very impressed with my show last night. Mr. Faramijo thought I was going to talk about the usual thing of ours of tit-tot on the island in the Indian Ocean of the oil. But he was shocked. From Villa, Somalia, I could see from the analysis, he was watching fully, because one of the members there called me and said he's watching, he's with us. I was impressed, because look, Africa would have prepared itself much earlier had this Ethiopian guy told us exactly. William, you might have read 1994, the genocide in Rwanda. Mm-hmm. If you follow the genocide, the indecision making, the lack of decision, firm decision, to make a decision to stop the Hutu extremists from killing the Tutsi and the moderate Hutu, from exterminating 2 million people. You won't accept this Ethiopian guy to continue with the work. He should just resign. Now that Trump, I think after this, Trump is going to pull out of World Health Organization. He will not fund it, because America funds over 50% or 65% of the World Health Organization. But instead, the man, you can't blame Trump now, because Trump says he regrets why he didn't close his airport. All his borders would have been closed much earlier. The man gave him wrong advice. But behind all this, Miriam, what do these two powers know, which we don't know? Mm-hmm. Mm-hmm. That is my next bit of investigation. And when I bring it to you, remember punchline, I am just a few meters away from discovering the whole problem. And I will say it, history will look after me.
Indeed.
When I have said.
And yesterday alone, the U.S., I say to have reported 1,800 deaths, the highest death toll in a day there since the outbreak of the coronavirus in the United States. And it's very sad there what is happening. And also we were looking at the headlines here, and on top of the Daily Nation there, I see breakthrough mass testing coming soon thanks to a major innovation by researchers at the Kenya Medical Research Institute, KEMRI. Mass testing for coronavirus will soon be possible, giving the country the true picture of infections. So we see our Kenyan scientists there coming up with major innovation that could help the country in really doing a lot of mass testing to ensure that we have the right numbers. As they have been saying out there, African cases are a bit low, and one of the reasons as to why perhaps there's not been enough testing kits across the continent, so that's why the numbers are a bit low, and also other factors. So we see here a major breakthrough by KEMRI. And they're saying soon there will be mass testing will be possible in the country because they're innovating and they're coming up with the test kits. So that will be a major boost in terms of curbing the spread of this coronavirus in the country, Doctor.
Miriam.
Yes.
Madam, thank you very much for bringing that in Africa, maybe they are, don't speak like the Mr. Tedros. What is his name? Tedros. Tedros. Yes, my sister, the situation in Africa, if you have this thing, you can be seen, you have it. This is not rare flu. When it is raining, you have your nose in Africa, normally our nose flow down, but you don't dry up your lungs. This thing came by air. This thing arrived here by air. America allowed over 800,000 aeroplanes, passengers who landed in New York. Why is it that states in New York, and I'm telling you, states in the United States, like Texas, is free? Do you know there are states in those places that are free of corona?
Yes.
But states that allowed the planes to land the other side of Pacific, California, is closed down. People are indoors. New York is closed down. Rome is the pinnacle center. If you go to Rome airport, that was my first airport in the world in 1987 to enter Europe. The first airport I used was Rome, where my briefcase was stolen. So I have never forgotten that experience. Miriam, I've never told you this, but my briefcase was stolen, and I ran following the boys who stole my briefcase. Then they thought I had gone. I hid down, we using soldier tactics. I hid down there on the wall. The guy who ran, you know, as if it was a miracle. The boy who was running with my suitcase came to land on me, and I picked my briefcase with all documents. That was wrong. So all planes in from Asia, Gulf, the States, all these planes from South Korea and so on, most of them break their journey. They used to break in Doha, and Rome is the focal point for entering Europe, or if you want to enter the Mediterranean and avoid going to Europe through Switzerland Channel and coming back to Amsterdam, then you go to New York. You know, so Rome is a very busy airport. You can see that most of these diseases in Rwanda came by air. Ethiopian Airlines kept on distributing, dropping passengers. You see, we were very lucky in Kenya that the 276 Chinese who came, none of them tested positive. Mm-hmm. None. We are lucky. Very lucky in this country. All the cases, if you see in Kampala, all the cases in Kampala are airport. They are airport. Nobody in Buugwe, Bukwina, Kayunga, Bukalasi, Bududa, Emerald, Lira, Pakwach. There are no people there who have this thing. The thing centralizes itself around airport. All the people on quarantine, either who left the airport and went into those villages. Mombasa, the ships coming, the people coming in Mombasa, Kwale, the movement between Lunga, the area of Lunga, these are border points, entry points. This thing, it is normal. So the point that I'm trying to make is for somebody to say Africa has poor kids is like a Professor Jonathan Moyo, that madman from Zimbabwe, who says the Zimbabwe kids are defective and they're telling Zimbabweans not to use them. You see how people, when they want to grab power, and when they are in power, they speak different. But when they want to grab power, Miriam, they always speak in favor of George Soros. You know why? When a person says he's going to tell you that the kids are faulty, who is going to benefit? It is Bill Gates, it's George Soros, whose company manufactures these kits. So they pour them quickly to Africa. You see that? There is also a business angle in these things. As I told you, I'm nearing that. I'm a few meters away from bringing you an exclusive by Friday that will shock your lungs. It will shock your lungs. You can't believe it. I am just, my person in Wuhan is gonna deliver me something that I've been waiting for. Believe me or not, Africans, we shall find the truth. And then let's wait for these guys to say we pay the money. You wait. Hapo ndio third world war itaingia. Kama wanakutua take off Africa wakuje. Lakini kwa Afrika kulipa hii pesa hawezi. Everything is at standstill. How does a person pay? How does a person pay? We can't kill ourselves to get the money. You have seen the treasury is losing 1.2, 1.3 billion on a daily basis. 1.3 billion.
In terms of revenue collection.
That's what the treasury, yes, in the tax collection. So where will the treasury get the money to pay? Shall we pay saliva? Let's look at the Star newspaper.
Doctor, before we go to the Star newspaper, there's something here on page 3 of the Daily Nation that has really, caught my attention, and I've seen a bit of it on social media across the globe. But now, apparently, there's a surge in domestic violence linked to the COVID-19 pandemic, and in a country like United States, a report of the domestic violence increased in March in many cities as people isolate at home. Of the 22 law enforcement agencies that responded to the NBC News request for data on domestic violence calls, 80 departments say they had seen a rise of between 6 to 20% in March alone. Also in Kenya here, Chief Justice David Maraga announced that sexual offences have spiked across the country since more Kenyans started working from home and the government imposed a curfew. He said that the incidents now constitute nearly 40% of reported cases, and most perpetrators are close relatives. And also we've seen in Turkey, women have called and told us that they are experiencing violence at home. That is according to the president of the Women Associations of Turkey. We've seen Brazil, we've seen Tunisia, we've seen Kosovo, Spain, France, China, Italy, across the globe. What is happening the domestic violence has gone up? Or is it the pressures that has come from others, loss of jobs in tough economic times? What could be the reason of this after, the work, the order to work?
Bring it as a topic. 2 p.m. East African time.
2 p.m.
Full topic. Full topic for 1 hour and we disappear. Yes. It's a very good discussion because it will help so many people. Either we bring it now or we bring it at 8 o'clock when every man and a woman is in the house.
I think 8 o'clock would be perfect.
8 o'clock
when everybody
today.
has settled at home. Yes.
Why are you beating your wife? Why are you beating your wife? Some women are also some men are also, they used to cheat. Now they can't cheat. There is pressure, depression. Inakuja, huwezi kuenda kwa side dish. Bring it at 8 today. We want to educate to stop domestic violence. Stop domestic violence at this hour of curfew. But this hour of partial lockdown, all of you are together. We don't know what will happen tomorrow. Fellow Africans, don't beat your wife. Wife, don't beat your husband. You know there are some wives who are stronger than husbands, who beat taekwondo, kung fu. The last time I touched my wife, we had a quarrel with my wife, was 37 years ago. Just a quarrel. No. But from there, 37 years ago, I want to tell you frankly, when I hear her start the reggae, I say I'm going down the pub reggae. Why don't you do like a matanga? When you hear your wife is quarreling, now there is a curfew. Tell her, Madam, I'm in the study room. You stay in the bedroom. It's very easy. Those who might not have a study room, because I'm not God who created class struggle. I found the class struggle there. Yes, I'm not God. God created the class struggle. Today, on Wednesday, 8th, is it 8th or 7th?
It is the 8th April. Yes.
April.
Yes.
St. Luke again says, Jesus told the disciples to go ye ahead and get a donkey, which has never done any work. Ye. When they ask you who sent you for this donkey, say, the master said, a new donkey. That's a class struggle. It's a class struggle created. Jesus did not enter Jerusalem, the same Jesus who was at Capernaum, at the port of Capernaum on the Sea of Galilee, when he fed 5,000 people on 12 loaves and the particles and the fragments. Miriam, therefore, if you don't have a sitting room and a study room, that is part of the class struggle. You know, we must mix even in theology now so that people don't get depressed. So if you have a home, even if you have one room, if your wife is quarreling, you sleep on the floor. Let her step on your back and go out. Don't fight her. Don't beat her. Because the times are hard. Not only for you, for all of us, including the rich people. The rich people are not spending the money. You spend it to go where? Do you know the rich people by now, they will be going to Mombasa. Flights will be full. Miriam, this topic is very important. I think we better bring it and eat it nicely at night. Very nicely eat it. It is a very good topic, and the women should be encouraged to call in. Advertise it much earlier. Call in tonight, all women who are facing domestic violence, men who are facing domestic violence, men who don't know how to cook. They force their women to cook. I know how to cook. Yes, I can cook a full meal of even 60 people. I know how to cook pilau. Yes, you brought the subject of domestic violence. That's why I'm trying to defend the women.
Yes.
If a woman quarrel, there are some women also who have very sharp tongues. Kwa, 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 kwa. Anakupatia maneno kubwa. Even at this hour, anasema ona huyu, angalia huyu, look at this one. Especially this .com these days, .com. This .com. .com. I know Miriam might not be happy, but .com ladies, the .com ladies, anakupatia maneno. If you are used to artificial life of money, material, Mercedes, Range Rover, this is the time. And most of the violence, the Chief Justice said, is not coming from only poor families. It is coming from high end. You know, most of the high end problems, our programs are educative, Miriam. We are not here to do like the British say, they read the news on, what is that thing called?
Prompter.
Prompter, yes. Read the news on prompter. No, we are here to talk to people. Because people at this time need to be talked to. You have children in the house. Your younger children have come back. Don't shout at your wife. Don't shout at your husband. Please, all of you sort the problem back in your bedroom and quietly. And unite, come out in the mornings, united people. Elsewhere in Africa, those watching my program, it's true. Things are not very good. Things are not very good, especially people who are working at the front line like nurses, healthy workers. You have seen the healthy workers are on high demand, saying everywhere in Africa. You see, Samuel Karui has invented a ventilator. So Rebecca Machuki says he takes this opportunity to congratulate Samuel Karui.
Kairu.
So, Kairu,
yes,
for the good work that you have done. Thank you very much, Mr. Kairu. And I think why, Mr. Kairu, why don't you push further and bring this medicine, Baba? Bring this medicine. This thing needs this medicine. You know the Chinese are lying to us. Why don't you bring this medicine? Find the medicine. Do a mixture quickly. Africa needs it. Thank you very much. Over to Miriam. That topic, you coin it. I will give you to coin it. I will coin it.
All right.
Is it domestic violence? Domestic violence during the lockdown, partial lockdown? It is across Africa.
Yes.
Let's put it.
Yes.
Yes.
We'll brainstorm after this because I'm also looking at the time we have to prepare for the other show. So the Standard newspaper, yes. We have not finished. We just looked at one newspaper, so perhaps we look at the front pages of the Standard.
No, the other thing before you go,
yeah.
Because the other lesson, the other one is very easy. We are going to go over it. You and me, when I'm here, we shall help each other. It is very structured. The other thing is the Star newspaper. This guy, we talked about these 17 MPs. One of the senator came and ended up in a birthday party of Senator X with all these guys present. Now you have seen the report. Maybe read it for the people as we close down.
There it is on the front pages there. Alam, as 17 members of parliament and senators test positive for the COVID, and Kagwe tells Kenyans to brace for bad news as corona cases hits 172 here in the country. And
now you know what? These 17 MPs went to their constituencies, met all members of the parliament. So is the parliament in trouble?
It is. And today they were supposed to be convening the session, and I think it was called off.
No wonder Moses Kuria is not talking too much. Where is Moses Kuria?
Everybody has been in isolation.
Where is the deputy president of the Republic of Kenya? People are entitled to know. So many people are asking us, you see that? Have you been asked those questions as we people in the media? Where is he? He's not talking. Is he still digging? Is he at his home digging? Where is Ndindi Nyoro? He used to speak too much. We can't hear any fund that he is trying to raise for Ichungwa. Where are they? Are they not leading funding operations for their constituencies? We need to know anybody who has information regarding Ichungwa, Ndindi Nyoro, Mr. Moses Kuria. Who is the other one? Senator Murkomen. Yes, these are the men who have been talking so loudly. All of a sudden they have disappeared. Are they taking lock and a key? They might be, some of them might be committing violence in houses, domestic violence. You know, Korea is very violent. You remember he beat up a lady. So when you lock them inside, again, he could be beating up people. I'm not saying he has beaten the wife, because the wife is a very humble person, a friend of mine. But some of these guys operate in a bad way. Where are they? You asked a very good question the other time. 17 MPs might have gone everywhere for several days in their constituencies. That's why a lockdown is very necessary. I think a partial lockdown is necessary. I'm telling you. So accept what the president has said, move on. Thank you very much. That is the express. We started early. We have compensated, taken some of Miriam's time, 12 minutes from Miriam's time. 12 minutes past Miriam's time. There she is, the commander herself of the Central Brigade of Punchline in the CBD, miles away from me. I miss my office. I miss my station all the time live. But because of this, the people in Kampala listen to President Museveni's ideas. No opposition politics. Don't stop it. We cannot argue when we are about to go down 60 feet. Let's argue when we are on top and make that everybody is free. Even now, Ugandans should think of postponing this election. There is no need of an election. To elect what? People will be traumatized after this election. Ugandans, the president, Your Excellency, this election, you finish your time. In fact, you finish when God says there is no need of election in Africa. Because election in Africa brings us more chaos. We are more beaten in elections. Now, if you add the Corona-19, COVID-19, bring elections, we are going to be dead people completely. I don't see if any country like Malawi. I saw, have you seen what is in Malawi?
Yeah, they're supposed to be going to the elections in May, the repeat election, and the government took a 10%.
Who is going to stand? When will it finish? You are supposed to stand 4 meters away from each other.
But we see we saw a primary happening in the U.S. yesterday, which brought a lot of conversation from there. You know, they're still.
U.S. most of the people can do. They can use a computer quickly and go home.
But a lot of people could.
The ballot paper has to be given to you. You must come there and carry the ballot paper. Miriam, that's another topic we have found for Africa. You see that? Does Africa need elections at COVID life now? Should there be elections in those countries? Ethiopia was very quick. Uganda should follow suit. Tanzania should follow suit.
Oh no, Magufuli has said the October elections will happen in Tanzania. There's no postponing. He was very categorical over that.
Of course, he will officially elect himself. Who are going to be there? Who are going to be there? People fearing this election to the lowest turnout after Second World War will be this one. Who is going to be election? Where unasikia corona anaua watu, unaweza enda kwa election kweli? Who will campaign where? Who will sell? Who is going to sell the ideology? How will you campaign? We use social media. Who has social media in the villages? How will you campaign in elections? Most of the African elections, USA elections are done door to door. And they have network. Every part of United States of America has internet. Uganda internet is in some places. So how will you do the elections? Kenya internet here, President Uhuru brought loons. That's why we have efficient. Have you had any communication breakdown now? Loons are up here, enhancing the normal Safaricom, where 4G does not arrive, yes?
But generally, Kenya has good internet structures compared to other East African countries. So yes, we've been ahead.
So Kenya, we are about 2 years away from elections, isn't it? It might, will it take place?
Yes.
How?
Corona will be done in the next 1 month.
The laws that govern elections
yes,
must be put in place 24 hours, 24 months before the elections. We are in chaos. Can you think about that? Think about that. Think about it, and we shall create another talking point. As for now, from the command center of the political command center of Punchline Africa, miles away from the beautiful studio that I miss so much, with the beautiful beauty. Thank you very much. Thank you, Jesus Christ. Hold us. Remember, this is the day when Jesus asked for a donkey. It is today, Wednesday. Jesus today is preaching in Jericho. You didn't know? He reached Jericho on Monday. And the people told him, people were in my father's temple, they are cooking marijuana, smoking pipes, the scribes, the Pharisees, the haters. Tuko na waheta wengi Miriam hapa duniani. Wako kwa temple. Then Jesus said, bring me a donkey, and I arrive in style. Karl Marx calls that a class struggle. The communists say that's where the class struggle started, where capitalism versus socialism. We were left on Maram Road, while Tamaka Road began with palm sand is laid down. You notice that every function in where there are big people, including the Pope, there's a red carpet. Why? I leave that thought to you. It is because of that entry in Jerusalem. A new life was made. The same Jesus who arrived in that place was not the same one who was at the port of Capernaum in Galilee feeding people. Thank you very much, Miriam.
I'm joining the World Health Organization's Safe Hands Challenge. Hand washing is one of the most effective ways of preventing the spread of coronavirus. Wash your hands with soap and water for at least 40 to 60 seconds.